Hey everyone, Ryan here, and welcome back to a continuation of our Prosthodontics series, where we'll now focus on fixed prosthodontics, the final third of the prosthodontics topics covered on the board exam. So with that said, let's dive into the high-yield facts about tooth preparation. So the idea of a morphologic tooth preparation, tooth prep for short, also called a crown prep, is to uniformly remove or reduce tooth structure from the coronal portion of a tooth while maintaining its natural anatomy. And this is done to give room for a prosthetic crown to fit over the top of it. So now for some terminology. The occlusal surface of the tooth is reduced down while maintaining its original cuspal anatomy, and this is called the occlusal reduction. The primary part of the reduction is within the occlusal table, and just as a review, we can trace the occlusal table from cusp tip to cusp tip along the marginal ridges, and this would give us the outline of the occlusal table. But there's also a secondary plane of reduction directly over the functional cusps. So I will draw that in a different color, and the area I'm talking about is right over here. And remember, for the upper teeth, the functional cusps are the lingual cusps. For the lower teeth, they're the buccal cusps. So this is an upper molar, and so we're talking about the lingual cusps here being the functional cusps. So remember, this special bevel along the functional cusps is the secondary plane of reduction, and it's appropriately called the functional cusp bevel. I love when things have logical names like that. So the occlusal reduction refers to the entire reduced occlusal surface, while the functional cusp bevel is just this part here. Now the circumference of the tooth is also reduced down, and the name for the vertical wall of the prep is the axial reduction or axial wall. And the bottom edge of the prep that's left is called the margin, sometimes also called the finish line. So that's that edge that goes around 360 degrees around the tooth prep. Now, if this were an anterior tooth, then we would just replace occlusal with incisal, and there wouldn't be a functional cusp bevel. That's only for the posterior teeth. Alright, so here's another look at a tooth prep from the side view. You can really appreciate how the prep maintains the natural anatomy of the tooth, and it just looks like it's been reduced down in size in all dimensions with a clean margin, again, 360 degrees around the bottom of the tooth. So the occlusal reduction, again, along the natural ridges and planes of the tooth, and everything has rounded angles, as many things in dentistry should, and this provides structural durability for both the prep and the crown to go over top of it. The functional cusp bevel we just talked about, taking away a little bit extra tooth structure here allows the crown material to be appropriately thick in an area that will be under the most occlusal function. The chamfer finish line is a type of margin. We'll talk about this later. And the axial reduction or axial wall we also talked about. So one additional thing I'd like to mention, and you may be wondering this too, what if there is a cavity that's affecting part of this prep? Or what if a whole cusp was fractured off, and that's the whole reason they're getting a crown in the first place? Well, that's when we would do something called a foundation restoration or core, which is a special kind of filling that restores missing or decayed tooth structure before or while preparing a tooth for a crown. Alright, so you'll see this come up all over the board exam. The board exam study materials will have it, dental schools will teach it, the 3 principles of tooth preparation. And those being biologic, which is the health of the oral tissues, mechanical, which refers to the integrity and durability of the restoration, and aesthetic, how that restoration appears. So just like the Triforce in The Legend of Zelda, you need all three components working together in harmony in order to achieve a successful outcome. So we'll break these down and talk about them one at a time. So, biologic, the health of the oral tissues. Preparing a tooth does have risks. It can be dangerous if not done properly. So there's some injuries that we have to be aware of and have to avoid. So mechanical injury, as in we're preparing the tooth and the gingiva is very close by, very potential injury could be had. So mechanical injury, particularly prone where the thinnest gingival tissue is, and that's the lingual of the molars and facial of the premolars. This is just a good fact to know for both this part of the board exam. Also, the periodontics questions can refer to what having the thinnest gingival tissue. Thermal injury is also possible because we're working closer to the pulp. A lot of tooth structure is being removed, and so we have to be aware that we could be overheating the pulp. So what do? Use water spray to help cool down the area you're working on, using sharp cutting instruments. Dull instruments cut a lot hotter, and using intermittent light pressure. Heavy, constant pressure generates a lot more heat. Chemical injury is also possible with a soaked retraction cord and certain cements. We'll talk about cements in a separate video, but some of them can be more damaging to the pulp than others. And lastly, bacterial injury. This is something you can completely avoid with a properly fabricated crown, as bacteria could potentially leak under a crown that's not fitting the prep properly. All right, now for mechanical. This is the integrity and durability of the restoration. So this is really, really important. Probably, if I had to pick, the most important of the three principles. So retention form refers to those features that prevent removal of a crown along the long axis of the tooth prep. So this, I like to think of sticky foods. Think of something like caramel, something really sticky that's trying to pull the crown off. So retention is what's going to hold the crown on. And let me take this opportunity to go over two more terms here. Long axis, as you already probably know, is the imaginary line that runs vertically through the center of a tooth. And the long axis of the prep should be parallel to the long axis of the tooth. And just like the inside surface of a denture is called the intaglio surface, the inside surface of a crown that contacts the tooth is also called the intaglio surface. All right, and then we have resistance form. This refers to those features that prevent removal of a crown by apical, horizontal, or oblique forces. Basically, every other force other than something that's trying to pull the crown off in a coronal direction. So, retention in the removable pros world was prevention against vertical dislodging forces, and that's basically the same concept here, which is great. However, resistance is a new term. We didn't see this in the removable pros section, and this encompasses, again, every other kind of dislodging force. I like to think of occlusal forces, which are biting forces apically, sliding forces during functional movements, which can push horizontally or oblique. So I like to think of occlusal forces linked with resistance form. And you may see R and R form. That's the term used to include both of these together. So we have retention and resistance. All right, the next term I want to go over is taper or parallelism. And this is the angle of convergence formed between two opposite prepared axial surfaces. So basically, how much the crown prep is angled in as you go towards the occlusal surface. So this has very little taper, it's sort of cylindrical. This one has a whole lot of taper, and it looks more conical. for the board exam, this is going to be a board's question. The property that we have the most operator control of is the taper, or the parallelism. That's the feature most under operator control. Now, the smaller the degree of taper, the more retention you have. You can see the higher this is on the graph. The bigger the degree of taper, the more conical the prep is, and the less retention you have. So being somewhere around 6 to 10 degrees is ideal because that's going to give us more retention, which is good. We want retention to keep the crown from falling off. Alright, so height or length is measured from the occlusal or incisal surface to the crown margin. So that is the height or length of the prep. This is a general minimum value in terms of the height or length of a prep. We like a 3 millimeter minimum for incisors and premolars, and also I'd put canines in there, and 4 millimeters minimum for molars. Width is measured as the mesiodistal or facial-lingual dimension of the base of the prep. So height and width, those make sense. So the length, let's think about being a taller prep provides more surface area, which is really beneficial for us. A wider prep also provides more surface area, but with a catch, and I'll talk about that in a second. But just think in general, more surface area equals more retention, just like in dentures. Now lastly, we have the height to base ratio. And the minimum ratio that we should be shooting for is 0.4. So a bigger ratio, that means a taller prep, which affords you more taper. In other words, you can get away with tapering the prep more if it's a taller prep. Whereas a smaller ratio means that the base is larger in proportion to the height. A smaller ratio means a shorter prep, which will automatically have less retention. But also, if you have a really wide molar prep, it needs to have more height to push this ratio up. So width is not always helpful. To summarize, height is more important than width. A taller prep is always better, gives you better R&R form, while a wider prep can be good or bad. So, what do you do if you have a short clinical crown prep? Well, if you have a small height to base ratio, you don't have a whole lot of retention or resistance. So you could do clinical crown lengthening, but for the board exam, remember this, that a short clinical crown prep requires special retentive features, just like the grooves shown here. So remember, for the board exam, that buccal grooves are used to provide more retention, proximal grooves are used to provide more resistance. And these are just made with like a tapered burr or diamond, and they're placed in the axial wall to provide either more retention or more resistance for a short clinical crown prep. Great boards question there. All right, and this is how thick a crown of a certain material has to be in order for it to be strong enough, ideally, not to break and fracture. And if this is how thick the crown must be, that means that is how much you'll have to reduce the tooth to provide room for the adequate crown thickness. Unless there's already space there to begin with, which I'll talk about in the next slide. So there are a lot of numbers to memorize here. I'd recommend taking a screenshot of this for your reference. We'll talk about all of these types of crowns. We'll talk about gold crowns, all ceramic crowns, and the porcelain fused to metal or PFM crowns, and each of them will get a separate video later in the series. Alright, so reduction versus clearance. These are two terms that are often confused, and this is what I was referencing before in terms of having enough space for the crown material. So let's read the definitions. Reduction is the amount of occlusal tooth surface removed during the preparation. So this is what we've been talking about since the very first slide of this video, reduction referring to the amount of tooth structure removed occlusally. And you could also refer to this as occlusal reduction, and then we also have axial reduction, but I'm focusing on the occlusal reduction part. And then we also have clearance, which is the amount of space left between the tooth prep and the opposing tooth. So they kind of sound like the same thing. And I even have the same numbers listed here as being 1.5 to 2 millimeters being ideal. But these may not always be the same. So let me explain. Say if a tooth is tilted a certain way or isn't contacting the opposing tooth to start with, like in this image, there's already some space there before you even started prepping the tooth. So then you already have some space or clearance for the crown material, and you don't need to reduce as much. So let's say in this example you start with a clearance of 1 millimeter, then maybe you only need to reduce 1 millimeter to get your 2 millimeters of ideal clearance. So the lab only cares about how much clearance you give them to work with to build the crown. So that's the difference between reduction and clearance. You can kind of think of it like a math equation. The starting clearance plus the amount of reduction will equal the clearance that you end up with. All right, and the third principle is aesthetic, which is the appearance of the restoration. So we have our gold, our metal crowns, our PFM crowns, and the all ceramic crowns. And porcelain is a type of ceramic, but not all ceramics are porcelain. That's what this means. And so gold is arguably the best material out there, but for aesthetics, it depends on what the patient wants. So the bottom line is to leave enough tooth structure for the tooth to be healthy, which is the biologic portion, but we want to remove enough tooth for mechanical and the aesthetic requirements of the crown. All right, so let's talk about margins. So we have two margins I want to talk about. Margin number one is the edge or the shelf at the base of a crown preparation. So I showed you this in the very first image. It's this shelf right here that's left after you've prepped the tooth. There's a nice shelf there for the crown to sit onto. Margin number two is the part of the restoration where I'm dragging my mouse pointer along right now, the part of the restoration which forms its outer limit that adjoins to the cavo surface margin, or margin number one, of the prepared tooth. So there are two margins we can talk about, the edge of the crown and the edge of the tooth prep, both of which should match up and fit just like a marker cap on a marker. And this is a really, really helpful analogy for me, that the marker cap is the crown and the marker is the tooth. So both margins, these red lines, should match up perfectly when fitted and seated fully. Same thing for the crown and the tooth prep. All right, so that's a little bit about margins. Let's talk about margin location. So we have supragingival, which is above the gingival crest, equigingival, which is at or equal to the level of the gingival crest, and subgingival being under or below the gingival crest. So supragingival margins more adequately promote periodontal health. We talked about this at length in our periodontal videos, but subgingival margins can be more aesthetic, especially in the anterior, because they're hidden underneath the gingiva. So there are pros and cons to each of these. We also have margin types. There are more than just these four, but we're going to cover these main ones for the board exam. Okay, so the first one is the feather edge margin. This is a very acute, thin margin. It's less invasive. It provides the best marginal seal. However, it provides insufficient clearance for most materials. Not enough reduction required to provide the adequate thickness of crown material for most materials. It's also difficult to visualize. So for the feather edge margin, you can appreciate how this crown prep gently tapers out here at the very end. It's not generally used because, again, the crown material ends up being would be too thin at the margin. And that, or the lab is forced to over contour the restoration and bulk it out way out here, which is never ever a good thing. Now notice how the axial wall gradually tapers out. It's a nice, probably 10-degree taper or so. Now let's just say for fun, it went in like this and then kind of came out here. And this little area where it dips in would be called an undercut, which is a very, very bad thing because the crown won't seat properly and you removed excess tooth structure that you didn't have to. And since it's completely under operator control during the tooth prep, we want to avoid undercuts at all costs. So that's an undercut, and this is the feather edge margin. Again, not used because it's so minimal that we're not providing enough clearance for the crown material. Light chamfer is just a little bit more removal of tooth structure. It's about 0.3 to 0.5 millimeters thick, often used for gold crowns, which can be quite thin, and wide gold collars of PFM crowns. So here we can see it still gently tapers out, but there's a little bit more definition along the bottom, right along the margin there. So right here where the margin is, it's a little bit more defined. The feather edge was just kind of fell off, and it was super shallow slope. This is a little bit more defined. That's the light chamfer. Remember that being used for gold crowns, generally. A heavy chamfer is, yet again, a little bit more removal of tooth structure. Now we're talking about 1 to 1.5 millimeters thick. This is used for very overgeneralization here. PFM crowns and some all ceramic crowns will use this type of margin. So now we look at the margin in the image and it's even more defined here. So there's more of a shelf present at the bottom. Now this on the lingual, this is more like a light chamfer. It's a little bit less involved. I'll remove the drawing so you can really appreciate how this is just more defined, more shelf present than this one. So if not given enough room, the lab will be forced to over contour the crown, which is very bad. Over contouring the crown could result in a thick margin that sticks out, under which bacteria can accumulate, and the gingiva certainly won't be happy about that. And remember this as a boards question. The number one lab complaint is that the tooth is under reduced, and so the lab is forced to over contour the crown. So I talked about the undercut. I also want to talk about something else that we want to avoid, is if the margin, instead of sloping off like this, which is great, it kind of sticks up like this at the very end. And we get this J-shaped margin. This little thing at the end is called a lip, and that's where the margin comes up at the very end. Again, that's also something that's under operator control. We want to avoid that. Again, it's going to affect seating, and this is unsupported enamel, which could chip off and then leave an open margin. So undercuts we want to avoid. We want to avoid under reducing the crown, and we want to avoid over tapering the crown. So all these things that are going into are procedural elements of tooth preparation. The last margin I want to talk about is the shoulder. This is the most aggressive. Again, it's 1 to 1.5 millimeters thick, but it's a little bit different. Instead of gently sloping off, there's a bit more rigidity here. It's a bit more defined and a sharper angle at the end. So these are examples of shoulder margins used for the porcelain of PFM restorations or all ceramic crowns. Remember that for the board exam. It maximizes aesthetics because it eliminates the display of metal. And however, it's an aggressive preparation. Potential for pulpal embarrassment, basically getting too close to the pulp if you're making the margin really, really wide. So to summarize, light chamfer for metal, heavy chamfer for PFM and some all ceramic, shoulder for all ceramic. It's a super broad overgeneralization, but for the board exam, it helps. Alright, so one of the main last things I want to talk about in this video are the inlays, onlays, and partial crowns. These are all indirect restorations and are named according to the part of tooth structure being repaired. So an inlay occurs within the cusps. So this would be an example of an inlay. The restoration that's placed is in between all of the cusps, doesn't involve them at all. Whereas the onlay covers the cusps. This second tooth is an example of being restored with an onlay. It goes on to the cusp tips. And lastly, we have 3/4 and 7/8 crowns. They're basically a hybrid between the onlay and a full crown. So this is a full crown, this is an onlay. It's somewhere in between these two. They're named based on the estimated wall coverage of the walls of the tooth. So a 3/4 crown would cover 3 out of the 4 walls, usually with the buccal wall being spared. The idea is that it reduces the amount of tooth structure being prepared. It conserves tooth structure. That's the primary objective. They're normally these ones are normally fabricated in gold. And despite the benefits, these crowns are not normally prescribed in practice because they're technically super, super difficult. And a lot of patients, again, don't typically like the metal showing through their smile. Inlays and onlays are done all the time, mostly in ceramic, but they can be done in gold. But 3/4, 7/8 crowns are typically only gold and rarely used out in practice. But for whatever reason, I made sure to include this slide in the video because 3/4 and 7/8 crowns come up all over the board exam. They're all over. There are multiple questions you'll get on this. Most of them asking which of these treatment options would you pick. If it mentions something about conserving tooth structure, less restoration margin and close proximity to gingival tissues, more easily seated during cementation. These are all benefits of using them, even though they're not really used out in practice. If you see something like this, link it up to the 3/4 or 7/8 crowns. So definitely something to know for the board exam for sure. All right, and this last slide is just some random facts to finish up with. The occlusal point contacts on these indirect restorations and crowns are preferred to be broad and flat instead of really sharp to prevent wear. And the occlusal schemes used, you can use cusp to marginal ridge. It's mostly in class 1 occlusion. Cusp to fossa occlusal scheme is more in class 2 situations. Alright guys, that's it for this video. Thank you so much for watching. I hope you found it helpful as you're studying or preparing for the board exam. Thanks again for watching, guys. We'll start the next video. We'll be further diving into the world of fixed prosthodontics with Pontic and connector design. Thanks so much for watching.